program at Children's Mercy, working to promote healthy lifestyles through community collaboration. One of our three main initiatives is the Kansas City Physical Activity Plan, of which this is part. So I'm going to turn it over to Tanya.
Hello, sorry, you cut out, so I don't know what I'm telling everyone. I will say I am at a hospital right now, unexpected. So my husband went in for an emergency procedure. He's been in and out of the hospital all weekend. So that's where I'm at, not normal. I'm assuming it's an introduction about me, but I am part of the Wellbeing and Fitness team at Garmin. Coming up on 1 year here come December, and very excited to be part of one of the leads for this.
And we'll turn it over to Missy to do the introduction as the other co-lead.
Yeah, hi everyone. My name is Missy Barnett, and as Shelly said, I am the other co-lead for the business and industry sector. I want to welcome you all and thank you for joining us. A little bit about my background. I am an account manager with Corporate Fitness Works, and have been with them since 2011. And Tanya and I are both just eager to join this initiative for many reasons. Both of us have a passion for workplace wellness that has driven both of us throughout our professional careers. Being provided this opportunity to impact the physical activity and health of the community within our region was a strong factor in both of our decisions in joining the Kansas City Healthy Lifestyle Collaborative, and specifically within this business and industry sector as co-leads. And for Tanya and I, our hope is to just continue to be a driving force for support for physical activity in the working populations and within the local community of Kansas City and its surrounding region. And so, yeah, welcome and thank you again for joining us. I will go ahead and turn it over here back to Shelly.
Great. And I'm going to ask Natalie to go ahead and introduce herself, and then we can move on from there.
Sure. I work with Shelly at Children's Mercy and the Centers for Children's Healthy Lifestyles and Nutrition. And one of my roles is supporting the Kansas City Physical Activity Plan, and one of my sectors is going to be the business and industry sectors. So you'll be seeing meeting invites and newsletters coming from me mostly. All right, Chad, do you want to introduce yourself?
Yeah, I'm Chad Tower, Executive Director of the Kansas City Corporate Challenge. And most of you probably got an email from me about 2024 and how we are going to promote 31 activities for 2024 and getting people active and getting companies registered. And so that's what we do. We're all about, corporate fitness and wellness with Kansas City Corporate Challenge. And so we're looking forward to getting started with this committee, but also getting started for 2024.
We would like to thank the Kansas City Corporate Challenge Committee for choosing Children's Mercy to be on the cover of this year's registration.
Comes with a price, but it comes with a price.
We'll work on that. I'm going to turn it over to Lacey.
Yes, so I am the wellness manager here at Johnson County Parks and Recreation District. So Corporate Challenge is actually housed within the Corporate Community Wellness Department. And so Chad and I work closely on various things, but we talked through having us both on this sector. And Missy, I think we kind of agreed that we bring different things to the table. So I don't think there'll be a whole lot of overlap between our two positions in our networks. So I think it'll be a good fit.
We're glad you're both here.
Thank you.
Lori?
Hi, everyone. I'm Lori Schiffer. I am also with Corporate Fitness Works. I have worked with Missy for a number of years, have been with CFW for about 19 years. And before that, did a lot of community wellness and just working with corporate as well as commercial fitness centers over the years. I'm really excited to be involved with this. Missy asked me to be a part of it, and I'm excited to join you all. Looking forward to working with everyone.
Welcome and thank you. And then Shelby, I'll have you introduce yourself as well.
Hi, I'm Shelby Miller. I'm a registered dietitian and I work for a company called Marathon Health, and I work in a clinic that is Children's Mercy's employee wellness clinic. So we serve all of the employees over at Children's Mercy. So I do mostly like one-on-ones, some group programs, some challenges, things like that. And I heard about this from Shelly, and I too have a passion for workplace wellness. So I'm just excited to learn more and help where I can.
Well, again, thanks everyone for joining us. So as you can see, we're heavily dominant from a couple of organizations. However, the diversity with the backgrounds and what you all bring to the table is really great, and we do appreciate that. So first thing I would like to point out is making sure we bring additional people to the group if at all possible, and having them from different perspectives is really helpful. So Lacey already, brought that up. So she and Chad both work for Johnson County Parks and Recreation, but they come from totally different areas that can impact employee wellness through physical activity. And so we want people both from the program management standpoint, the benefits standpoint, like why does an employer want to have opportunities for physical activity for their employees and families, but also those who are implementing the programs as well. So there's the managing the employee wellness benefits, there's the deciding what the benefits are, and then there's the people who might implement programs that all come with different perspectives as to why this work is important, but also what do we want to include in strategies and tactics with a specific focus on physical activity. And I do want to make sure I mentioned that here at the beginning before we shift into the background for the physical activity plan. This work in no way do we want it to suggest or imply that there aren't other aspects of well-being that we are not addressing. However, we want to be clear that with this plan, it has a focus on physical activity. We do know that physical activity results in other types of benefits, specifically mental health benefits. There are nutrition-related benefits you get from being outside in the sun. And so those pieces are important. So this is not encompassing all aspects of well-being. So I just want to make sure you all, as you're participating, don't think we are neglecting or missing those other things. We know they exist. We know they're important, but for this specific plan, it is about physical activity. Okay, with that, does anyone have any questions before I get started? I'm going to go ahead and share my screen and share some background about how we got started in this work, so you all really have a better idea of what it is you're getting into and why we think this is important.
Shelly, really quick, I did want to add on, as we're moving into this, Shelly spoke about the different avenues and specialties that we are looking for individuals to add to this group. If you have any recommendations or anyone in mind that you think would be interested in being a part of this, definitely share with Tanya and I or Shelly, and we're happy to move forward and get some information to them as well.
Thanks for that, Missy.
Mm-hmm.
Okay. I think you all know this, so I'm going to skip through some of these first slides. This is not anything new. So the importance of physical activity has been well documented through research for years. In fact, in 2012, The Lancet, a prominent medical journal, issued a supplement all about physical activity with this statement that you see on the screen. So in view of the prevalence, global reach, and health effect of physical inactivity, the issue should appropriately be described as a pandemic. That was released in 2012. In the upper right, you can see Dr. Bill Cole, who is an avid supporter of our work and a participant in the National Physical Activity Plan. He presented at a conference we hosted in 2018, where he shared the same information. Keep in mind, that was all before the actual pandemic that we all just went through that came out in 2020. Results from research related to that pandemic would also suggest that Those who are more physically active have better outcomes from viral illnesses such as COVID, flu, pneumonia than those who are not physically active. So we know that physically active is important for a whole host of reasons, and we have the research to support it. One of the reasons we think it's so important in Kansas City, there's a couple of things. Number one, the National Physical Activity Plan has part of their goal to implement more local or regional physical activity plans. So they have been looking for inviting others to participate in this work on a much more local level. So they have a plan for us to use as a guide from the national perspective, but that's really not going to hit everybody at the individual level in individual cities, regions, etc. In addition, the American Fitness Index demonstrates the importance of the need for this work in Kansas City. These are scores from 2022. You can see, I'm just going to highlight a couple of things here, and we're really just going to look at the overall rank and score right now. That's that top line in pink. So the best score in the country was a score of 85, and that was in Arlington, Virginia. If you look over to the right, you can see Kansas City, Missouri at number 88. Not great. If you look in the upper right corner, you can see in 2008, Missouri was number 19. And in 2021, we were 76. So we've even decreased farther than that. Physical activity is a significant component of this fitness index. And so for us, continues to demonstrate the need for this work in our area. As I mentioned, we sit within the Kansas City Healthy Lifestyles Collaborative. That was formerly known as Weighing In. We have been a program at Children's Mercy Hospital for 15 years. You can see, originally we were set up to address and to prevent and reduce childhood obesity. We know in our 15 years of work that a lot of people don't see themselves as impacting or being a part of the childhood obesity system. So we've been shifting our language to the promotion of healthy lifestyles for the last few years. Our vision is that children experience optimal health in the Kansas City area where active living and healthy eating are supported for all. As I mentioned, we have three main initiatives. The physical activity plan is one. We also address nutrition through a hospital-supported community garden. With that, we have a focus on improving access to healthy food and reducing food insecurity. And then our third initiative is the Healthy Lifestyles Initiative, which has a focus on promotion of healthy lifestyles through healthcare settings, specifically primary care. We're going to focus on the physical activity plan. Related to the physical activity plan, in 2022, we sent out over 110 newsletters to over 950 partners. We hosted over 200 meetings since we started this work for the physical activity plan in 2020. Our team is made up of Natalie, myself, Katie Amy, who you might also have met. She and Natalie have similar roles in our program, but support different sectors. And then Robin Shook is a physical activity researcher and the director of the Kansas City, both the physical activity plan and the Healthy Lifestyles Initiative. So again, I'm just giving background here. This is not anything new to you, so I'm going to skip through this. We know physical activity is really important as a determinant of health. We know Kansas Cityans are not achieving sufficient levels of physical activity. We also know that no single program or policy or business can address this alone. We need collective action to both together and across societal sectors. And I'll talk about the different sectors that are involved in our work in just a minute. We see ourselves as a convener for our region, which is why we're taking the lead on this. And we hope that others see the physical activity plan as a roadmap for collaborative, cross-sectoral action to create safe, equitable opportunities for physical activity. Okay, how this is set up is using the National Physical Activity Plan as our guide. Again, I've already mentioned, have the goal to create safe and equitable opportunities to live an active lifestyle in our region. The plan is set up with 10 societal sectors. We are the 10th sector to go through the strategy and tactic process. The idea is each sector identifies the strategies they want to focus on. What are the tactics they're going to use to implement those strategies? And after those are complete, then we get down to the work of action, which is how do we identify those implementation opportunities that will help us better move this work forward together. So that is what we are beginning today. At the end of this process of strategy and tactic development, we will have something similar to what you should see on your screen. The other 9 sectors have completed this process. You can see by these cards, this is really just sort of visual representation of how many sectors are involved. So they're color coded. So each of those little colors at the top represents a different sector. You can see the names of the sectors up there as well. And you can see some of them have 3 strategies. Some of them have as many as 6. I think our public health sector is the one with the most. And there were so many we couldn't include this on here. And I thought I'm not going to waste another slide today because we're not focusing on the actual strategies. But anyway, this serves the purpose to highlight what the end result will sort of look like. So as I mentioned, the National Physical Activity Plan does exist. It was created and set up as a comprehensive set of policies, programs, and initiatives designed to increase physical activity in all segments of the U.S. population. It is designed to be used for us as a guide. I wanted to highlight a few things that we've already modified to make a little bit more sense from the local level and to support work we've already done through the Kansas City Healthy Lifestyles Collaborative. These are the 10 societal sectors of the National Physical Activity Plan. Business and industry, that's this one. Community recreation, fitness, and parks, we call that parks and recreation. Education, we break down into 2 different sectors, one for schools and one for early care and education. Our work locally has enough movement in both of those to keep those separate. We have faith-based settings, we have healthcare, we have media and communications, all like the national plan. We do not have military settings, nor will we have military settings. That's really more of a national focus. Doesn't need to be done necessarily on the local or regional level. We do have public health, we have sport, and for transportation, land use, and community design, we call that infrastructure. So a couple of subtle modifications to how the national plan is set up. As you can see here, I have the sectors listed. We have the co-leads. I believe all of our sectors have, not all, 2 of our sectors don't have co-leads, but the vast majority do. It's easier to distribute the work. We bring people from diverse backgrounds, which we think is really valuable to helping us get a comprehensive set of strategies and tactics put into place. Some of the sectors are now into the implementation phase. We have a couple that actually haven't met very much. Faith-based settings being an example of that. They were hit hard by COVID and have been focusing, our sector lead has been focusing on his own personal health, but then also trying to get parishioners back in person in their congregations. And so this is taking a back seat. Again, what we're trying to do is meet people where they are versus trying to force people to do something that, while important, might not be relevant at the time. This work is also supported by funding from the Enid and Crosby Kemper Foundation. So as we get into implementation, we do have a small pool of funds to be able to support our work. Any questions about the sectors that we have moving forward right now before I go on? I'm about done wrapping that. I'm about ready to wrap this up. Okay, you already met our sector leads. Thank you again to Tanya and Missy for taking on the challenge of moving this work forward. And now I want to get into show you the strategies from the national plan that we will use in our first meeting to reflect on and think about whether or not these are the ones that we really want to focus on and whether or not they're relevant to Kansas City. Before I show you those, I do want to point out that on the national level, the business and industry sector Does focus on health risk, reducing health risk for chronic disease related costs, and it's associated with association, I don't know, I'm probably getting the grammar wrong on this, but with reduced worker performance. So that's really what we're thinking about here with the business and industry piece, and why we're bringing in those who work in employee wellness to the table to think about this from a business perspective. Increasing rates of physical activity can improve the health of your workforce, which in turn relates in improved worker performance, improved, reduced absenteeism, and other productivity metrics that make this relevant for them. Okay, the national plan has 5 strategies that they've identified. I'm going to leave these up here for just a few minutes for you to take a look at. And this is really just from us. This is where we would get started. As we go through the strategy prioritization process, we like to reflect on the national strategies. Do they make sense on a local level? Is there anything that's missing from it? Do we like the wording of it? Do we think the wording needs to be modified, updated, have anything added to it? And in some cases, we've had sectors who have chosen to break it down. So they, separated one strategy into multiple strategies so as to make it easier to either track or implement. I'll give you a minute to take a look at that. So as I mentioned earlier, the end process will look something like this. These are sport strategies. We could have 5, we could have more, we could have less. In some groups, they've chosen to focus on a smaller number of strategies in the short term versus a larger number of strategies. So we're really trying to get feedback from you all to help us think through, because I didn't mention this at the beginning, but this is not my area of expertise. While I have a good understanding of the importance of physical activity, how to be physically active, how to coach and counsel those to be more physically active, the employee wellness perspective is really not my area of expertise. Again, why we're looking for those of you who do work in that world to give us feedback. We use a variety of different tools to get feedback. We've done it through surveys. We've done it through collaborative whiteboards. This is an example of strategy prioritization using a collaborative whiteboard. This was actually in the media and communications sector. As we go through the process, we'll look at the strategy. We'll talk about barriers to success, how we might be able to overcome them, who might be able to implement a particular strategy. Does it need to be tailored? Is it already being done? And who might be missing? If you all know of other tools that we could use to make this process easier, we are certainly open to those. We are modeling this sector's work after the way it's been done and successful tools used in other sectors. Okay, in terms of timeline, this is our first meeting where we're sharing background. We're recording this meeting. We'll send it out within a week or so. Feel free to share the recording with anyone else you think might be interested. The second and third meetings would be where we're reviewing those strategies. We begin ranking them and determining what makes sense for Kansas City. With 5 strategies, there shouldn't be any reason why we can't get through all 5 of those strategies in 2 meetings. If we get through them faster, that's great. We'll just advance our timeline. The next 2 meetings are really looking at the individual tactics that have been identified by the national plan related to the specific sector. So we'll review each of those tactics along with I said sector, I meant strategy. We'll review each of those tactics along with the strategy that it's tied to, and we'll talk about similar things. Are those tactics important? Are they relevant? And should we prioritize them or rank them? Well, we're allowing a couple of meetings for that as well. And then the sixth meeting would be finalizing and confirming the strategies, the tactics, the wording, and a description of the sector that makes sense for Kansas City. At that sixth meeting, we might have time to come up with implementation opportunities, but after we're done with those first 6 meetings, we generally shift the work of the sector work group into action. So now that the strategies and tactics are fully developed, what are the ideas of the group in terms of moving the work forward and into action? At that time, we can decide the best model for doing that, whether it's aligning with the chamber's work again in some way, whether it's aligning with just individual organizations. For example, how would Kansas City Corporate Challenge implement some of these strategies through their off-season opportunities? I think Chad is already doing some of this great work and may not even be thinking of it like that. But how do those practice leagues tie into year-round physical activity? How do other opportunities offered through corporate challenge? And I'm just picking on corporate challenge because you're here, Chad. But how does that work? How do other park and rec organizations tie into year-round employee wellness activities, whether that's hosting activities in a park setting? I don't know, I'm sort of making that up. And then how do other organizations like Garmin tie in, whether it's through their wellness program or incentives that they might have available for employers as they are trying to encourage their employees to be active. Those are all just examples of how we can move this work into action, whether you do it at your own business level, whether we do that as a group here. With that, I'm going to stop talking and see if you all have any questions, comments, thoughts. Who's missing? Does this make sense? Does the process make sense to all of you as we review it today? Okay, great. That's the most important thing. Does it also sound reasonable? So for example, can you all commit to 6 likely 1-hour meetings? And we have not determined the entire length of time. That's another part of the conversation. If we're going to host 6 meetings, knowing that our first meeting is going to be November 13th at 2:30, do you think it's reasonable to host at least 2 meetings, the first 2 meetings to get through the strategy prioritization process by the end of the year, knowing that we're going to have one holiday and then another couple holidays coming up right after that? Do you think that's a reasonable timeline? It looks like you're all thinking.
No, I mean, and this group is not quiet. So, I mean, why are we being bashful, everybody? So I'll start. Missy, Lori, I know you like to talk. I don't think that's not doable. I mean, your goal would be to present this when? May, June? I mean, when do you want to get it out? As soon as possible? Is there like a deadline? We have to have this done by a certain time, or what's your goal?
So we don't have an established deadline of when we need this to be done by. Our next meeting is scheduled tentatively November 13th. So then that second meeting, if we did 2 before the end of the year, would be probably mid-December at some point if we're looking at that tempo. But as far as the tempo and the cadence of these meetings and how quickly we move through this is a little bit determined by all of us. What we can manage. Shelley, would you agree with that?
Yes.
So the hope is, I think what we had discussed, and Tanya, correct me if I'm wrong, about every 3 to 6 weeks, trying to get a meeting to move into that next stage and that next progress. So to get through those 6 meetings, we'd be looking at around 5 to 6 months.
That's what I was wondering, was what that actual timeline was. And I mean, I think if you're thinking a meeting every 3 to 6 weeks, I mean, I feel like that's doable.
For sure. I think we could for sure get 2 more meetings in before the end of the year.
Mm-hmm.
Perfect.
That's great news. And I think that that's doable on our end as well. We want to have as much engagement as possible. So what we're trying to do is just plan ahead. We don't want to overwhelm you all. I know you all have different things going on at different times. Chad, we're hoping to get this done prior to the kickoff walk. Fingers crossed.
You might have seen some of that timing, Chad. I don't know if you picked up on that.
That would be good timing, probably.
But we can accommodate whatever is thrown at us. We've had all kinds of challenges thrown at us, including a pandemic and switching from hosting things in person to shifting everything to virtual. And then individuals, both personal and health related issues that have impacted moving some of the work forward. So we will move at whatever pace we can all tolerate, with the goal of trying to get a meeting a month. I mean, that's just a nice round figure. Okay, so if you're all okay with that, our first meetings, like today's Monday, our next meeting is scheduled on a Monday. Does Monday at 2:30, is that a decent time for all of you? Or should we be looking at something else?
Works for me.
Perfect.
Yeah, works for me as well.
Shelby, does that work okay for you as well? Perfect.
I can adjust.
Oh,
I can adjust something to make it work.
okay.
Thank you, Lori. If that's the case, we could say this is let's see, taking this Monday out of the consideration. The next meeting is Monday, November 12th, the 13th, which is the second Monday. Does the second Monday work well for you all? Or should we do, like, today is the 4th Monday. Maybe we should do the 3rd. I don't know. I'm throwing that out there to see if there's any.
It makes no difference to me.
Okay.
So that would land for December, either the 11th or 18th. Is that what you're asking?
Yes. I think it would be great if we could get all 6 meetings on the calendar now. It just allows for people to hold that time better through the entire process. And then it also allows us to invite others as they express interest.
Yeah.
If you look at it, the second Monday might work better because then you got December 11th. I mean, you get to the 18th, not that everybody's taking that week off because Christmas is coming up, but it kind of gets you a little further away from that. Look at January 8th instead of, you get a little bit later, the 15th, there's holidays in there. And then, look at February, the 12th is probably a little bit better than the 19th as well. So, I mean, the second Monday, it might be better as far as kind of missing some of those holidays as you get at the end of the year and start of the first of the year, if that works for everybody.
Yeah, I was thinking the same thing, Chad.
I like it.
Great. Then we can go ahead and get those. We'll set out, let's see, Natalie, normally how do we do our meeting invites?
Natalie,
You're muted, Natalie.
Right. I usually make the Eventbrite and then send the link in the newsletter. And then there's usually a marketing campaign that also emails it reminding that it's open for registration. It's also on the website. I don't know if you guys have clicked through that, but there's a tab at the top for upcoming meetings and there's a calendar and it shows all of the KCPA plan meetings and you can register through the link there too.
Does that work okay for everyone?
Mhm.
Yes.
Okay. And we can go ahead and get the rest of those meeting dates and time, the registrations for those set up so that they're already ready to go. You can register for all of them, drop them on your calendar and make it super easy. And then you'll also be able to direct people to our physical activity plan website, which is kcphysicalactivityplan.org. If you wanted to invite other people to participate, they can go to the meeting registration information that will be housed on the website, and they can sign up for any or all of them. As Natalie puts together a summary of this meeting and includes the recording, that recording will be available on the website as well under the business and industry sector. Right now, that sector just says coming soon. We're going to add information about our first meeting and direct people where to sign up so that, well, with the intent to make it as easy as possible to invite other people to attend. Okay.
So
Thank you.
Shelley, if we come across somebody that might be interested in joining the committee, who do we send them to? Who? Send them to you so you can kind of give them the lowdown to see what the interest is, see if it fits.
You can do a whole bunch. You can do whatever is easiest for you. If it's easier for you to just send them on to myself and Natalie, that would be fine.
Okay.
You can also include Missy and Tanya as the sector co-leads if you'd like to do that, because they may know the people you're recommending better than we do. An alternative is we have an email invitation that we've drafted and been using to invite people. We can certainly send that to all of you, and you're welcome to send that on to anyone you think might be interested. It also has our contact information in it. It has a link to our website, and it has a link to a previous recording that shares the background of this work. So that also provides additional information for them to decide, you know, before they follow up with us if they're interested. So we'll send that out to all of you as well for one additional piece to recruit others. If you know of other organizations we should be sharing this information and invitation to, please let us know. We went to the Chamber's Workplace Wellness Action Team because it's so well known, and I've participated in that for a number of years. But there may be others that we just don't know about right now.
And I would add to what Shelley said, with those other organizations, our design is to be another pillar of support for those organizations. We're not looking to, dive into it or any of that, but just to be a point of support and another point of feeding people into that program. So when talking with those organizations, keep that in mind with them as well.
Anything else? Any other questions, comments, thoughts? Or just a big fat thank you, and the award goes to Tanya for attending the meeting in the most unique and stressful situation.
Yeah.
Yeah.
That's
All's good.
dedication.
That's good. I don't know if it's dedication or if it's just knowing when to say no sometimes, but we're learning in different ways. And we're working on that. We're good. We're good. Nothing.
Well, thanks for joining us, Tanya. And thank you all, everyone else for joining us as well. We really appreciate it and value your expertise as we continue to move this work forward. Okay, look forward to seeing
All
you
right,
all
thanks.
at least on the 13th.
Thank you.